Hello, everybody. Thank you so much for being patients at the Phoenix Men's Health Center. I'm putting this little video together here with Dr. Morse. Dr. Morse is one of our docs on staff. Dr. Morse specializes in telemedicine. You know, the practice is growing really fast and we're getting more and more patients. And we're starting to incorporate a lot of telemedicine and or video medicine into the practice. This has a lot of benefits to it. It saves the patients a lot of time. It saves them having to fight traffic. But also, they don't have to take as much time off from work, also possibly getting childcare. All of these things can make it difficult for you to get into the practice. So we have developed this program to make it easier for you guys. What we're trying to do is keep it seamless and smooth. So this is where Dr. Morse is going to come in and helping us. So you guys know that we've had some phone conversations with your docs where we will call you throughout the day, you know, periodically between our patients. Well, one thing that we discovered was that we're always running behind. And, you know, it's just difficult because we spend a lot of time with our patients. And whenever we have to do the phone calls, it can kind of be, you know, disruptive during the day and the flow. So we want to put all the phone calls together. Dr. Morse has been working with us for quite some time now. Dr. Morse helps us on the back end, helps with our IT. He also helps us with our patients as well. So we thought this is great. Dr. Morse is working from home. He has his whole setup at home to do video conferencing and telemedicine from home. So let's have Dr. Morse help us with this and take on the telemedicine patient load, right? So here we have Dr. Morse. So Dr. Morse, go ahead and introduce yourself to the patients.
Hi, everyone. My name is Dr. Michael Morse. I've been with the practice for a few years now. I'm excited to get started on this telemedicine program and really help you guys be more efficient with these visits and be able to get the same expert level of care that you're used to.
Right. So I think the thing what Dr. Morris and I really want to draw the point home is that the level of care you guys are going to get is exactly the same. Dr. Morris, you've been working with us now for how many years? 1 year,
Well,
2 years?
I started in 2018, then I kind of moved to Texas for a little bit, came back to
Right.
Arizona, and here I am, been here since 2022.
Right, right. So you've been with us for a while now. So
Mhm.
Dr. Morris, you know how the practice works. You know how we operate, right? You know
Oh,
the
yeah.
ins and outs and how we do things and so forth. So this is going to be a seamless, you know, transition, if you even want to
Yeah,
call it. So the main point is to make things easier and more efficient for our patients. The cool thing about this now, it doesn't matter where you are in Arizona, we can help you. It doesn't matter if you're rural or if you're local. It doesn't matter if you're stuck in a lot of traffic or you live out somewhere in Wilcox. I mean, we see patients in Wilcox, Prescott, Sedona, some Flagstaff, right? We even have some that are outside of Wilcox, Arizona. So it's pretty awesome, right? So all of this is available to you guys. So we also want you guys to know if you have family members that want to see the physician, but they have a hard time coming in, we can also do that. So Dr. Morris, you set up a way for us to do labs, right? Where we can
that's right.
actually have a lab program set up where someone can
That's
go to
right.
their house. Is that possible?
That's right. So let's say you lived in Yuma, for example. We have a way to we work with a lab company that actually has every lab that we can order, even specialty testing that we offer in office.
Mhm.
And we can have a phlebotomist come straight to your house and draw your blood right from there. All it takes is a kit that's shipped to your house. Then we organize with the phlebotomist to get to your house, or you can go to a phlebotomist that has a brick and mortar office. Either way, and then the lab reports come straight to us, and we have your visit just like we would in person, except it would be over video.
Awesome. So we can even draw your labs at your house. How cool is that? And we can also shipping the medications, correct? So we
That's
also
right.
have a shipment program set up for these guys. And how does the shipment program work for them?
Yeah, so we have a very robust shipping department now. I don't know if you guys are aware of that now, but basically we have shipping departments. So anytime you need a medication, we bundle that up. If it's a regular medication that's coming to you monthly, we have it shipped to you on a regular basis. That's auto shipped, so you don't even have to think about it. It just comes to your house, and you're going to get a notification, so it doesn't sit out in the heat. But it's great because then you don't have to think about it. You don't have to call for a refill. And
Mhm.
that's actually the auto shipment is something is a perk that our members receive. So that's something to think about too, is getting on our membership.
Right, because we also have the membership programs, right? So we have
Right.
different levels of membership programs and entail different things. Now, anyone can do telemedicine, right? But we do have certain memberships that are going to be focused on just doing telemedicine, right? That's going to be our RX program. But if patients are also on the other programs, they can also have a telemedicine visit as well, right?
Right. I should
Okay.
clarify too, even if you're not on a membership, shipping is
Mhm.
still available.
Shipping is still available, right? That's gonna be available for everybody.
Right.
We know that now, our schedules are just getting so busy. We have to try to find ways to make this easier for our clients. So we're actually really, excited about this.
Yeah. And another benefit too is if you go on vacation, let's say you go, somewhere, you say you go to Minnesota for 3 months, we can still do a visit and we can still get you your medication if you're there, if you have a stable address.
Mhm.
So lots of possibilities here for you to be able to do telemedicine, whether you're out of the city of Phoenix, whether you're on a trip out of Arizona, we can still make it work for you.
Right. Because we have some patients that are snowbirds, right?
Mhm.
We have a lot of patients that
Right.
live in Arizona in the winter, and then in the summertime they take off.
Yeah.
So this is great for those guys too. We keep their medications going seamlessly and easy,
Yeah.
right? It's
Yeah.
really, really awesome. Now, with they're doing telemedicine, Dr. Morse, are they locked into anything? Like, does that mean they can only do telemedicine, or can they also come into their practice should they need something?
No, that's a great question. And we're very fluid with that. You can do telemedicine exclusively, or you can
Hmm.
come into the office if you need to get a procedure. So obviously, I can't do a procedure for you over the camera,
Right,
which you could, but not quite yet. You can go to the office and see Dr. LaProvost or one of our wonderful doctors who can help you. Maybe you're going to get a P shot. Maybe you're going to get a nutrient IV. You can still go into the office and get all that anytime.
right. Remember, guys, we have all of this available to you. We are guaranteed the number one most comprehensive men's healthcare facility. If not in Arizona, if not in the United States, if not the world. Yes, I'll even say that. I know that we are leading the way for this new revolution of men's healthcare. I know this. I know that other clinics are trying to copy us. I know other clinics are trying to do what we're doing, which is fine, right? Absolutely. The more the merrier. The bottom line is we have got opportunities for you guys and we have options for you guys. Remember, we have got IV therapy here to enhance your immune system. We got all kinds of injections to help your immune system. We have ozone therapy, which is an advanced therapy that's excellent to support your immune system. We can fix your joints, rotator cuff problems, knee problems, any kind of joint rehabilitation. We can help do that. 80% of the time, we can avoid surgery. We can order CAT scans for you guys. We can order full body MRIs. We could do cancer screening, right, Dr. Morse? We also have another test called GRAIL, where we can do a blood test for cancer. It is quite revolutionary.
Okay.
We can write you up a whole order, an MRI for cancer screening as well.
Yeah. We've also greatly expanded our peptide repertoire.
Oh,
So
yeah.
there's all kinds of different tools we have at our disposal now that are excellent. Whether you want to increase your testosterone in a different way, using your own body's mechanics, or whether you want to work on your human growth hormone, there's
Yep.
peptides targeted for that. There's also our weight loss program, which we have several different GLP-1 agonists available now besides just semaglutide. We now have retatrutide, one of the first on the market. That's actually twice as effective as semaglutide. So if you haven't heard of that, I'd highly recommend taking a look at that one and consider
Right.
that a weight loss.
Right. I mean, like, how awesome is that, right? In the facility that you guys are already a part of, you guys are already currently patients. That's why you're getting this email. You have access to all of these things. Peptides are the new revolutionary thing in medicine. We got them. Ozone therapy is going to be the new thing you guys are going to start hearing about it. We got it. We even do Botox, right? But
Yeah.
I mean, we do it. The peptides are fantastic, and you guys have all these options. I
Yeah.
mean, Dr. Morris knows firsthand about the peptides, how effective they are, how well they
Yeah.
work.
Yeah. And we can ship them overnight to you if we do a telemedicine visit too. So that's
Yeah,
lots of options here.
really, really, really awesome. All kinds of cool stuff. So remember, guys, you guys have options. Dr. Morris is going to be taking over our telemedicine program. So you guys might be getting emails from us about Dr. Morris. And now you guys know who Dr. Morris is. Thank you very much, Dr. Morris.
Right. All right. Great to speak
Dr.
with you
Morris,
guys.
yeah, Dr. Morris is fantastic, right? He's excellent on the phone. And the cool thing is, Dr. Morris has all set up for you, so he can do everything from us. Because Dr. Morris, we're always talking back and forth, right,
Oh,
throughout the
yeah.
day.
Oh, yeah. Yeah,
Right,
we're pretty much in constant communication over messaging, and I'll even pop into the office sometimes too.
right, right.
Yeah.
It's awesome. So so
Hmm.
we're all connected. We're all connected instantly.
Yep.
So I have questions, Dr. Morris can ask me. If he has questions, he can ask me directly. So all day we are virtually connected and we're communicating with each other. And all the patients are the patients of the Phoenix Men's Health Center. So our job is to help you guys as much as you can with all the tools and all the doctors that we have, right?
Absolutely.
Awesome. Cool. Excellent. Is there anything else, Dr. Morris, you wanted to ask, add about the advantage of the telemedicine, or what are some of the advantages you've seen, Dr. Morris, with the patients?
Yeah, so one of the best parts about telemedicine is you can just do it right from your home or right from work. You don't even have
Yeah,
to take off if your boss allows it. You know, you can just pop into another room, private room, and we can just chat for
right.
15 minutes. And that's the great part is, you know, normally you're used to these 30-minute appointments scheduled in an office. Sometimes that's a bit too long for a lot of you guys who are really busy professionals. We
Mhm.
can be a little bit more efficient over camera. So, you know, we don't have to do a physical exam. You know, physical exams in the virtual space look a little different. We still have to do them, but it's quick and easy, and you know we could be pretty efficient that way.
Yep.
Yeah.
Awesome. Remember, guys, it's about your goals. What is important to you? So every time we have our office visits, via it's in person or telemedicine or via video, we're always going to start off with what are your guys' goals? We don't
Mhm.
expect you guys to know everything we do, but if you guys can tell us what your goals are and help to verbalize that to us, we can go through our toolbox and we can pull out exactly what you need to get you your goals and help you accomplish those goals. It's pretty awesome. Cool. Excellent. All right, Dr. Morris, thank you very much. Thank you for our virtual visit
Yeah.
here.
Thank
And
you,
thank
and
you
thank you
so much
guys.
for helping our patients. I know you're going to do an amazing job,
Oh yeah.
right? And thank you guys for understanding and bringing, welcoming Dr. Morris on board to help you guys with all of our telemedicine needs.
All right. Thank you guys. I'll see
Awesome.
you soon.
Cool. Excellent. All right. See you guys.